Yeah, I suppose one of the key things is about keeping healthy yourself. Um, really understanding what are the things that you need to be wary of around symptoms, what you need to do to protect yourself around, how you look after yourself and your whānau through that process.
At the level of within our whānau, it will be basic things like hand washing, using paper towels and tissues. Like any flu, people will start with symptoms like having a fever, having a headache, having a runny nose, feeling ill, aches and pains. Very, very general symptoms, but they will rapidly become much worse. People will become very, very ill, have very, very high fevers, and become completely incapacitated by the virus. If you're in the role of looking after some people who are unwell, then you probably need to stay separate from people who are well. You probably want to have a face mask and gloves and some clothing just to reduce the risk of transmission. Temperature is going to be a really crucial thing. Dehydration is going to be a crucial issue. When you're 40 degrees or 41 degrees in temperature, you'll dehydrate pretty quickly. So that's important to have water, maybe a little bit of salt and sugar in that water so that they can absorb that quickly. We're looking at 8 glasses a day, kind of the basic advice, but somebody's a little bit hotter, so we're going to add in another couple of glasses a day. They may well not be hungry at all, and that's fine, because for a period of 4 or 5 days, if people don't eat much, I'm not too worried about it, but temperature is going to be a really crucial thing. If I can get you damp, either with a face cloth or with just a warm bath, and then not dry you off, your own heat will evaporate the water, and you will lose heat as a result of that. Your temperature will come down. And that's really good for when people are really, really hot. And that'll bring your temperature down by 2 or even 2.5 degrees. In the kind of flu epidemic that we're talking about, that may save lives. For babies, when babies get that sort of unwell at about 41 degrees, they start to have fits. The fits themselves are not a major issue. It's called a febrile convulsion. That's okay. The important thing is to get their temperature down and do it quite quickly and keep it down. So cool cares and using wet flannels and some paracetamol are going to be really important. Tamiflu is a good medication for stopping the growth of a viral illness like bird flu. We can't be sure how effective it will be. I think we can make some reasonable guesses that it might be helpful, and so the government has stocked up some hundreds of thousands of doses, and that should help protect some of the key workers in terms of getting us through that emergency period. I think it's really important that you have a plan with your family. It will include having things like emergency supplies of water and food, and if there's anybody in your family who has special needs, then you should plan for that as well. And that might include having some stocks of medications. It might include having some special food if that's appropriate for your family. It might also include having some plans of what you will do in the event that some social services break down, and how you'll cope and support each other, how you'll check up on each other, even though you're living in different parts of a big city or perhaps you're living out rurally. I think it's really important that families spend a little bit of time just planning how they will support each other through that period.
We can do as much as we can think of, which is what we're doing at the moment. Ultimately, though, it comes back down to the community. It's a community that has to respond and look after itself. The concern we have is that people get sick, that they're sick at home alone, for example. You might find you've got mothers with young children who are looking after them by themselves. You've got old people living together. And it's what concerns us is that often these people slip through the cracks. So we'd be very concerned that people don't run short of food, that if they're sick, someone knows about it and can look after them. If the worst happens and they die, then someone knows about that too and can go and help their family with that.
So one of the approaches that's being put together is what are called community-based assessment clinics, or CBACs, CBAC, CBACs. These are clinics that will be established in a pandemic. They don't exist now. They will be specifically put in place during a pandemic, and people will be instructed, if you think you have flu or your family member has flu, go to the CBAC at such and such address. This is where they're located. and you'll be assessed there, and you'll be given advice and or treatment and so forth. And also, if you have welfare needs, so for instance, if the advice is, well, yes, you've got flu, you need to go home and have someone look after you for possibly for a week, but you're a person living alone, that will be the opportunity to link the person into broader welfare support. So things like the Red Cross or many other community organisations.
Yeah, I think people will go to the marae. We might then want to have a whole bunch of marae decide how to cope with all of this. So there might be marae that you'd arrive at and somebody would say, right, you can stay here, stay separate, and then perhaps if you're still well after a week, you can move on to this other marae, and then those who are sick are getting cared for, and we might need to organise those sorts of things. And I think marae have done that historically as well. In my head, there's a good example would be something like Rewharewha, which started as a place that was going to be for healing and for health and to be a hospital and so on. So it's not out of the realms of possibility that groups of marae would come together and plan those sorts of things.
Yeah, the name of the organisation is Rewharewha or Tainu, and it was put together by Pumi Taituha. We went to ask him and asked him, well, give us a name. It provides primary care. From clinics down to community health workers. Our plan at the moment is looking at the big picture. These are the problems that we will face if we don't do something about it. And then how do we then address those people who live in those communities, the services that they need. The organisation was based around Te Pue's experiences and the kinds of problems she faced in trying to address the pandemic. The first thing she did was she tried to address that influenza by isolating people in different parts of her community, in particular in Manatawhiri. And then she found a way to transport the dead from, I understand, up the river and then buried them. As she went along the river, she picked up the dead and then buried them in Taupiri. So she had a plan, her and her husband had a plan, how to remove the people from the communities they were living, or from the marae that they were living in. And so that's something that we need to consider. If it does come again, what is our plan? Not to pick up the dead, but to keep them alive.
One of the things we need to do then is make sure that those marae that are going to be centres for people to go to actually get resources like food and water. And from my point of view, I'd like to make sure that somebody's dropping off food and water for those sorts of areas. But those people who are doing that don't have any contact, so we'll make sure that those people doing those services stay well and we can carry on. And that's going to be really useful for marae to make those kind of decisions early on, to be a marae that actually people who are unwell will come to this marae. That's a very, very different marae to one that says, okay, we're going to provide support services to other marae in our area who are looking after the unwell ones. So we only want people who are well here. We want to make sure that we've got good gardens and good networks for getting kai and water to those people. We've got some people who know how to go and do this checking list. We've got to get through 500 households in a day, make sure everybody's well. We're going to do that by phone. We're going to visit. Whole lots of planning, eh? I think if marae can be in that position and say, in terms of their planning, they've looked at what they need in connection with other marae and other community resources nearby, and then can go to the government health agencies and say, right, if this thing happens, we're going to need this amount of water delivered, we're going to need some food, we're going to need some bedding. Our plan is that you drop that off, and then we know what to do with it. So that it's really the infrastructure to distribute those things that already exist and make sure that it gets to our people. Because historically we haven't had that, and part of that's been the kind of the racism and the policies of previous governments. If that's not the issue now, fine. Then the issue is that we must not be missed out in terms of the planning.